Firstly, good afternoon and welcome to this seminar titled From National Policy to Local Practice, Drivers, Tensions and Future Scenarios for UK Adult Social Care Workforce Change. And it's by Professor Shereen Hussein and Dr. Erika Kispeter from the London School of Hygiene and Tropical Medicine. Both Shereen and Erica bring a wealth of experience and expertise to studying the adult social care workforce. So we're actually really pleased that they're here to do the session today. And we're delighted to see lots of you join us for this session, which is part of the Centre for Care and Circle seminar series. For those of you who don't know me, my name's Liam Foster, and I'm going to be chairing the session. I'm a professor in social policy at the University of Sheffield, and I'm also part of the Care Work for Research group at the Centre for Care, where Shereen and Erica are also based. So I'm really looking forward to hearing about their work. So in this seminar, Shereen and Erica will share insights from understanding the drivers and implications of care workforce change, exploring how policy and broader system factors are transforming the adult social care workforce throughout the UK. And they'll speak for 30 minutes or so. Over to you, Shereen and Erica. Looking forward to it. Thank you.
Thank you everyone for joining us, and thank you for the introduction, Liam. As Liam said, Shereen and I are both based at the London School of Hygiene and Tropical Medicine, and the only reason I'm stuck on this title page is to warn you that we left out the tensions from the title as we were practicing and timing. We decided that the drivers and the future scenarios are what we are going to focus on today. The research group on care workforce change is the context of this study. As Liam just mentioned, there are a number of smaller teams within the group. Shereen and I did research on policy and system change. Our colleagues from the University of Kent were focusing on the organizational level, care providers, and innovation in terms of workforce innovation. And our colleagues at the University of Sheffield were looking at, and are still looking at, how care workers themselves drive and respond to workforce change. So these are the three levels, and our presentation today is mostly, but not entirely, at the macro level. Everything that we are going to say today is included in the report. This is the cover page of that report, and at the end, Shereen will share the link to this report, and there's also a connected policy brief. Most people on this call are very familiar with the social care workforce's situation, but just in case, I've included this introductory slide to sort of justify why we think that studying the care workforce is a worthwhile endeavor. It's a huge workforce. Most of these people who work there have poor terms and conditions, and their pay is low. And as a result, there is poverty is quite common among care workers. This, given the size of the workforce and given that this is a largely female and older workforce, this has serious consequences for social inequalities, for gender inequality at a sort of labor market level as well as for individuals. Given what I've just said about this workforce, it's hardly surprising that there are challenges in recruitment and retention. And as a result, or as a way out of these challenges, various governments have introduced various schemes to recruit migrant workers. But this creates its own problems. You are all very familiar with the focus on policy and political focus on the care workforce. This has become much more much more obvious since we started this study. Um, so the study's aim was to understand the policy drivers of change in the social care workforce in the UK and some of the implications of these changes. We designed four research questions. The first one is really identifying the policies. The second is understanding and describing the implications. The third research question on this slide is a little bit complex. This is really to describe that we were trying to ask participants, and we have asked participants to develop future scenarios. This is a specific research method. Shereen will say more about this. And in a sense, much of our methodology was building up towards these future scenarios. And the final research question is kind of not part of this arc. It's about the relationship between key policy reforms. And this is the question that we are not talking about today. Visually, this is how our methodology looked like. We started with a literature and policy review, which we called a knowledge review. And by the end of it, we had a list of policy reforms and other macro level drivers of workforce change. We then took these short lists of policy reforms through a series of consultation events, which I will describe in a bit more detail. And by the end of that, we had a very short list of policies, which we refer to as building blocks. And then stakeholders used these building blocks to create, build, design future scenarios. So the literature and policy review is the fairly obvious part of this methodology. The stakeholder consultations were a series of consecutive events where we took the lists and the identified policies from the review to various groups of people. We started with the Centre for Care's Voice Forum, and then we worked with 25 stakeholders who represented trade unions, the ones that are very important for the social care workforce, various charities of informal carers, of older people, commissioners from local authorities and commissioners' organizations, other sector organizations such as associations of care providers, and also researchers and academics from think tanks, but also from universities. And all these groups of stakeholders came from the four nations, not just from England. We organized two roundtable discussions, which were very close to focus groups because there were a lot of interaction between participants as well. So it wasn't just facilitators talking to participants. For those who couldn't join these focus groups or roundtable discussions, we conducted one-to-one interviews. And then, and this is the final point of this description, there was a prioritization workshop. We adopted a methodology referred to as rapid prioritization. And at this particular event, we asked people not only to identify and comment on key policy drivers of care workforce change, but also to think about which ones were really important, really consequential. And as you can imagine, there was quite a bit of debate here. And then the scenario building sessions took place. We asked participants to build a future scenario, responding to the question, what might the social care workforce in the UK look like in 2030 35. We asked them this question in 2023, so it was just over 10 years, the time scale. And so after the methodology, this is the list or the table that came out from the literature and policy review. It's really two lists. One of them is what we called social care policy reforms, and the other one is as you can see, it's a long-term intersecting drivers of workforce change. Some of these are actual policies, and some of them are debatable, whether they are policies or not. For example, the digital technologies, there are policies encouraging or sort of driving care providers to adopt technologies, but a lot of this would happen anyway because of market pressures and because of global trends. Again, with the migrant workers, when we started this policy, there was already a skilled worker visa, but there were obviously other macro level drivers that shaped the movements of migrant workers into the UK and out of the UK. The ones on the left are more straightforward, and you will be very familiar with these policy reforms. Personalisation, the professionalisation of the direct or hands-on or frontline care workforce, and finally, the integration of social care and health. So these were, Shereen and I looked at our findings and came up with these lists, which are not perfect, and then took them to stakeholders who, in addition to the meetings, the online meetings we had with them, roundtables or focus groups, we also set up a whiteboard where they could leave comments and questions for a whole week before the actual meeting happened. And these were anonymous. And then we also had the online chat, just like in today's seminar, as well as what they said when we were meeting. So there were these three slightly different modes of discussion. And as you can see, the first one I put here, just to give you a flavor, was an anonymous comment when somebody said that, yes, these reforms are reforms, but they are not really the important ones. They are just high profile ones. Somebody in an interview very candidly said that, well, actually, this government or various governments in this country don't really have policies for social care. What they have, social care workforce, what they have is migration policy. And the final quote here, I put it here again to give you a flavor of the kind of discussion that happened and how it was really, really focused on the social care workforce. Occasionally, people veered towards talking about social care in general, or obviously talk about people who draw on care, because it's not easy to stay so focused and things are intertwined. But this one, for example, came from a discussion where people talked about personalisation and how all these expected changes that people were really looking forward to, how care workers will work differently and it will change anyway the way care work is done. This particular participant said that because of the conflicting expectations and the conflicting systems within social care, it doesn't really happen, and care workers are pulled between task-based and outcome-based approaches and the very rigid rules for inspections. And when they feel pulled, they also feel demotivated, and even that's one of the drivers, one of the reasons why care workers often might leave social care. So these were not just to give you a flavor. They also suggested a lot of other policies and macro level drivers that were not on the list that Shereen and I identified. This is just a list here, and obviously feel free to ask ask questions at the end, but devolution was an obvious one. We had a few suggestions that were very specific for Scotland or for Wales. At the time when we were doing this field work, the National Care Service proposals were beginning to develop in Wales and England as well as in Scotland. And then the last two suggestions on this list are not policies, certainly not national policy drivers, but somebody or more than one stakeholder suggested that anything that happens in the NHS, who actually have a workforce strategy, will shape the social care workforce as well. And also the fact that unpaid informal carers get older, that also has an impact on how the social care workforce is doing their job, how care is organized and delivered. So after the comments, questions, debates, and prioritization, these were the final policies and other macro level, policy level drivers that we had. If you remember the original one, commissioning wasn't there. Commissioning was voted in to replace personalisation. And instead of the adoption of digital technologies and digitalisation, we had something called market structure. The other items on these lists were sort of refined and reworded, and that there was a lot of discussion and negotiation behind these seemingly minor changes. What is also important, and this is the last sentence before Shereen takes over, that commissioning and the local social care market structure, these are not national level or not macro level drivers of change. These are very much at the local authority levels. Thank you, and over to Shereen.
Thank you very much, Erika. And for those that I haven't met before, so I am Shereen Hussein, and I'm a professor of health and social care policy at the London School of Hygiene and Tropical Medicine, and I lead the Care Workforce Change Research Group at the Centre for Care. So can we move forward? Yeah, so these are the building blocks. So we've put it in that kind of form. We imagined having Lego bricks, and I will now take you into the heart of the foresight work and how we build a scenario. So we use these blocks, and next slide. we work it with the same 25 stakeholders across multiple phases, and for the scenario building, they were asked, what might the UK social care workforce look like in 2035? So as Erika said, it was just less than 10 years. And they built their scenarios using the 6 policy building blocks we've shown before and identify together. Everybody worked to identify these blocks, so there was a sense of ownership to that. But they also had to think through context. So we asked them to think about the economic, political, and technological context and consider impact on different groups. So we ask them, when you build your scenario, think about who will be impacted, what are the implications for care workers, for care providers, and for people receiving the care. And we played a game called Fortunately, Unfortunately. So once we have built these blocks, so we use it as a methodology that used a lot by international organization in thinking about future scenarios. Once you have that, kind of initial scenario, what could go right, what could go wrong. And each group also had a wild card to introduce something unforeseen, so an unforeseen factor that is not in the 6 building blocks. And that last element turned it out to be particularly interesting, as we will see. Next, please. So the first scenario is in many ways the optimistic one. So it's a fully transformed system underpinned by significant sustained public funding. So key to this scenario is the term professionalization. And to simplify that term is kind of thinking about pay parity with NHS staff, clear career pathways, and genuine attention to workers' well-being. What I find particularly notable is that participants also included opportunities for asylum seekers when they talked about this. Signaling a more humane and inclusive approach to workforce supply, a point of tension as we see how immigration policies have been developing. And while integration with health was seen as central, participants were clear that social care should retain its distinct identity, a point that came up repeatedly in our consultations. Next. So, for this scenario to materialize, the requirements obviously are substantial because they were thinking about significant change. Public consensus on social care as a critical infrastructure, higher taxes or a dedicated insurance scheme, and really effective local commissioning. The workforce impact through this scenario would be significant, including reduced gender inequalities, a more sustainable workforce, and a greater social integration. And I won't dwell on every point here, but the key message is that this scenario deemed political will and public engagement, which neither of which could be taken for granted. The second scenario takes a different route to transformation, not through new funding, but through optimizing how the existing system works. So the pivot here is from task-based to outcome-based, person-centered commissioning. And it's a compelling idea, and it builds on what the CARE Act 2014 already set out, but has never been fully implemented. And what's interesting about this scenario is the attention to the micro level implications. For example, the travel time is paid, 0 hours contracts only are chosen by choice. And these details we found that matter enormously to workers on the ground. And the stakeholders kind of knew that. And similar to scenario one, we asked them what are the requirements. So next slide. So this scenario for us hinges on local authorities having both the capacity and the data to commission differently. And one nuance worth flagging is migrant workers in home care may need enhanced language support in a more personalized system. And while this scenario opens up opportunities for innovation and innovative providers, it creates real challenges for service users managing their own budget. The complexity of personalization and its workforce implications has been underexplored in the literature, and our stakeholder actually reinforced that gap. Thinking about the third scenario, so actually moving back one, Erika, yes. So now this was the wild card. So, and it's arguably maybe one of the most thought-provoking of the three scenarios. And this scenario, remember that we said that a little bit earlier, this conversation. So it's really interesting how things have been developing in that space. So this scenario imagines a future where assisted dying has become legal and culturally accepted in the UK. And really, given recent parliamentary debates, this feels less hypothetical than it might have done when we collected the data a couple of years ago. Care workers in this scenario become central to navigating a profound ethical and emotional complexities. The scenario raises urgent questions about training, consensus, and mental health support, and about what we are actually asking of a workforce that is already under enormous strain. And similar to the previous scenarios, we asked them to think about the requirements and impact. And the requirements here are not primarily financial, they are cultural and organizational. And it's also thinking of a societal shift in how we understand end-of-life care. There is a focus and investment in training and psychological support, and the recognition that some workers may opt out of the end-of-life roles altogether, which has real implication for workforce planning. The broader point that jumped out at us here is assisted dying risks deepening socioeconomic inequalities in end-of-life options. And this is not really a workforce issue alone, but it brings some of the social justice issues around this. So, what are the commonalities and differences here? So, and really, this is maybe the slide I most want you to sit with. So despite the very different routes each scenario takes, the commonalities are striking. So all three scenarios recognize the need to improve job quality. All three acknowledge the systematic pressures around recruitment, retention, and sustainability. And all three place care workers, their skills, their well-being, their agency, at the center of any meaningful transformation. The differences are in the mechanism. So scenario one is a workforce focused and funding driven. Scenario two works through commissioning reforms. And scenario three introduces a societal shift that the system has not yet reckoned with. But the thread running through all of them is this. So you cannot transform social care without investing in the people who deliver it. Right, so let's think on the really implications and recommendation, which will draw this kind of brief presentation to an end to open up for discussion. And I will close with some of our recommendations, which you will find in details in the report and the policy brief that we've published last year. And three of the main recommendations are deliberately broad. So first, local authorities need to be empowered, not just expected, to commission fairly. And to be empowered requires a lot behind the scene, to have decision-making authority, but to have the means to do the right thing, the right funding, to have the tools to enable them to do the right commissioning by understanding their local population needs. They need data and resources and capacity. Second, the workforce development must be funded sustainably. So over and over, there have been conversations with the stakeholders around training, career progression, mental health support, but and these are not add-ons, they are central to systematic change, but nobody knew where this funding these issues could happen in a sustainable manner and an equitable and fair manner. And third, we really need a genuine public conversation about social care, and we've been talking about that, but there are lots of opportunities now with the CASI review and others. And it just, in this context, we do not connect the taxes that they pay and the care they or their families will one day need. So the structure of the delivery and design of how social care is commissioned is fundamentally flawed. How it is funded, the fairness question about who shoulders what, and the role of informal carers. But at the end of the day, the care workforce provides to everyone, regardless whether they are funded by the state or funded by out of pocket. And usually they are not rewarded in either way, in the right way they are rewarded. So, I will end up by saying that one of the main conclusions that we have come out of this work, that there is no coherence. We dropped in the synergies and tensions, but there is no coherence in how social care policies are designed when you think about the implication on the workforce. The workforce are pulled in different axes in different ways, and they are in many ways assumed and are invisible. And social care doesn't sit in isolation, it sits within NHS policies. And a lot of NHS policies, including the latest 10-year plan, assume that social care will fork a lot, but never kind of explicitly discussed or expressed in clear terms how they would meet some of the expectations. So you've got the report and policy brief to read, and I hope you do read and send us your comments, and we have the discussion today. Next slide is just to thank you from both of us, and here are our emails. And the next slide is just to tell you where this work sits within, of course, the Center for Care, and to provide you general information about the Center for Care website and our LinkedIn. And also we have a lot of blogs and publication on the website. Thank you, and I hand over to Liam.
Thank you very much, Shereen and Erica. Really, really interesting stuff.